All right, Kuwait, it's 30 minutes into the 8 o'clock hour, and you know that on every Tuesday, we have a very special guest with us here to talk about a certain health topic or a medicine topic as well. So, all the way from our collaboration with Dhaman, we have Dr. Ashma Kawalekar. She's a general dentist. Good morning to you, doctor, and welcome to the show.
Good morning. Thank you for having me on the show.
Thank you for giving us some of your valuable time. It's such an honor to have you on the radio. Now, Dr. Ashma, I would like to ask you, could you give us some quick tips on how can we maintain a good oral hygiene?
All right. I have 5 tips for you. First, and the most important tip that everybody knows, but very few follow, brush your teeth twice a day. You use a fluoride toothpaste and a soft bristle toothbrush for this. Mm-hmm. And you have to brush in small circular motions over your teeth. Now, brushing by using too much pressure or too hard with hard bristles can hurt your gums and teeth. Mm-hmm. So it's always important to use a soft toothbrush. Also, don't forget to clean your tongue with a toothbrush or a tongue scraper. My second tip is floss every day. Mm-hmm. You can't reach the bacteria in the tight spaces between your teeth and under the gum line with a toothbrush. So that's why daily flossing is very important. Mm-hmm. Some people find it hard to handle a floss.
Yes.
So for those people, you can use an interdental cleaner. What this is these are like small finger-sized brushes which help to clean the spaces between the teeth. Mm-hmm. And my third tip is replace your toothbrush every 3 months or sooner if the bristles become irregular.
All right.
Fourth, eat a diet that promotes healthy teeth. Mm-hmm. Any food or drinks with sugar in them increases your risk for cavities. So it's best to eat natural, non-processed foods like whole fruits and vegetables.
Yes.
And also calcium-rich foods like milk or yogurt instead of unhealthy snacks.
Yeah.
And it's important to limit sodas, coffee, and tea. Not only do these sugary drinks increase the risk of obesity, but the combination of sugar and acid breaks down your teeth.
Yes.
And lastly, visit your dentist every 6 months. Why this is important is because firstly, most cavities occur in hidden places between two teeth, and this is where the toothbrush cannot reach. So it's best to catch these cavities when they're small or minor.
Yeah.
And secondly, everybody must get their teeth scaled or cleaned professionally every 6 months to remove the tartar buildup on your teeth. Mm-hmm. So if you have a problem in your tooth and the more you delay going to the dentist, the more expensive it's going to be for you to fix it.
Yeah, and probably the more hurtful it will be if you have any oral problem or dental problem, I believe.
Yes,
Dr.
exactly.
Ashma, before I move on to the next question, recently we've been seeing this water floss machine that started to be very popular nowadays. So I would like to ask you about this. Is it really effective, or maybe the normal floss, the fiber floss, is more than enough?
The water flosser is actually recommended for people who are having orthodontic braces on. Mm-hmm. So for those people, it's difficult to floss. It's not possible for them to floss because the wire comes in between. So which is why the water flosser is recommended for those people. It also can be used for any other regular person actually who's just like lazy to use a floss. But yes, it is effective.
It is.
Yes.
Thank you for that.
Because it uses a combination. Sorry, it uses a combination of water and pressure as well. So it's like flushing out the debris and the food that's stuck in between your teeth.
That's really cool. Now, can the oral health affect your general health in general? Like if you have any oral problem or problem in the gum, let's say, would that affect any other areas in your body as well, or your general health?
Yeah, not a lot of people are aware of this, but your oral health can actually influence the health of your physical body and vice versa, actually. Mm-hmm. So first, let's talk about how your oral health can affect your general health. Mm-hmm. Now, the mouth can act as a portal of entry for bacteria. So if there is any ongoing infection or inflammation in your mouth, the bacteria can enter your bloodstream from your mouth, and which may lead to inflammation in other parts of your body, such as the heart, and specifically the inner lining of the heart chambers and the valves of the heart. Mm-hmm. So which is why some patients that have artificial heart valves, it's very important for them to maintain good oral hygiene.
Mm-hmm.
Yes, and there are also studies that have shown that gum disease is linked to illnesses such as diabetes, respiratory disease, osteoporosis, and rheumatoid arthritis.
Mm-hmm.
Also, there are certain pregnancy complications that can occur because of periodontitis.
Yeah.
Periodontitis is a gum infection which damages the soft tissues and the gums and the bones that are surrounding the teeth.
Yeah.
So, yes, so this is how oral health can affect your general health. And on the other hand, the condition of your oral health can actually give you signals that something may be off in other parts of your body as well. For example, suppose you have recurrent lesions or ulcers in your mouth, which may signify an HIV infection.
Yeah.
Or if you have continuous bleeding of the gums, it may indicate a possible blood disorder. Or if you have bone loss in the lower jaw, it may be an early sign of skeletal osteoporosis.
Mm-hmm.
And if you have tooth surface loss, then it can be an effect of an eating disorder. So this is how oral health and general health are closely related.
Oh, that's very interesting. So your oral health can actually tell a lot about your body, and that there might be something wrong happening in some place in your body, which is something really interesting. Now, regarding this, doctor, what are the signs and symptoms that show that you have an oral health problem, and how can you know that this problem is serious? Like, for example, maybe at certain times, people might have like a bleeding in the gum from hearing, from once in a while, from one day to the other. It might happen in a certain time of the year and then disappear. So how do we know that it's a serious problem and we have to go and see a dentist?
So signs that show that you need to contact your dentist are if you have red or tender or swollen gums, and that's not normal.
Mm-hmm.
So your gums need to be either light pink, or there are some people that have pigmented gums, which is okay, but they shouldn't be like tender or painful or swollen.
Yeah.
Gums that bleed often when you brush or floss. This indicates that you have a gum problem. It's not normal to have gum bleeding when you brush. This means that you have gingivitis, which is inflammation of the gums.
Yeah.
Okay. Also, if you feel that your gums are starting to pull away from your teeth, they are sort of loose or they are receding from your teeth, that also means that there is some problem with your teeth. If you feel your teeth are moving or becoming loose, and I'm talking about permanent teeth, not milk teeth in children.
Mm-hmm.
So permanent teeth should not move or should not become loose. So if they're moving or becoming loose, it means that the bone or the gum surrounding the tooth is having some problem. And also if you have like unusual amount of sensitivity to hot or cold foods or drinks, or a lot of pain when you're chewing, or if you have persistently bad breath or an unusual taste in your mouth, this probably means that there is food getting stuck in a cavity somewhere inside your teeth. So these are the problems, or these are signs which show that you need to contact a dentist. So it's very, very important that you visit your dentist every 6 months.
Yeah.
And we must always remember that early detection and treatment of problems with your gums, teeth, and your mouth can help to ensure a lifetime of good oral health.
Absolutely. Well, Dr. Ashma, thank you very much for your time. And we had a really great conversation and talk about oral health and oral hygiene, and wish you a very good day. Thank you very much.
Thank you. Thank you.
Have a good day. So on the phone, we just had Dr. Ashma Kawalekar, and we talked about oral health and hygiene. Every Tuesday, we have a special segment that we talk about a health topic with a different doctor, and it's a collaboration with us and Dhaman. I really recommend you to go and read more about Dhaman. At Dhaman Center, they have a whole health program for people here in Kuwait to provide a full spectrum of integrated healthcare services throughout leading and holistic network of primary healthcare centers and hospital, as well as a wide range of support services like diagnostic laboratories, imaging centers, pharmacies, and care and medical educational facilities as well. So hopefully one day we're going to have a special segment with them to tell you more information about their services, because Dhaman, they do provide a lot of service for the expat community here in Kuwait.